Thank you everyone for your patience. Thanks to the community. We will work around with some description. Many of the folks online will come in. So you know, stop you from contributing as you normally would. Thank you again for your patience. Yeah, firstly, begin by welcoming Lynn and Councillor Thompson to the IJB. We're very pleased to have you. And constitution. You will have noted the IJB consultant using first names, so I hope you don't mind if I call you Lynn.
Absolutely.
Please feel free to call me the same. I had at one point thought of introducing a penalty charge every time someone calls me chair, but I'm told that would be unethical. So whatever you're most comfortable with is absolutely fine with me. Can I also take this opportunity to thank Councillor Malik for his contribution to the IJB and for his scrutiny, which is what it's all about. And we'll get to the formal approval of this in just a moment. Coincidentally, we meet today on the 30th of June, at the end of the first quarter of our new financial year, also the end of the first quarter of our new delivery plan. Whereas today we will rightly look back at some of the work that's been done over the past few years, but also begin to see how we're to start reporting on the work that has been done to date. I'd like to take this opportunity, if I may, to thank all the staff across the partnership for their hard work. And that goes too for volunteers and carers across the city who make an invaluable contribution to everything that we do. A couple of key items of note to draw your attention to, and that is to welcome the opening of the Nook, coincidentally in the square just behind us on the 17th of June. This is the new mental health and wellbeing hub for Aberdeen, which was designed collaboratively. I think it's a great example of what we can do as a city when we put our minds together and work together as partners. Colleagues on the IJB will remember we had a presentation from SAMH back on the 30th of September, who outlined their proposals for the hub as a welcoming space anyone can use without referral or without queues. I'd also like to take this opportunity to note the opening of the new GP walking clinic at the village opened last week. This is a Scottish Government initiative to roll out walking clinics across the country, and we'll be very interested to see how that develops. Moving to the papers, the risk appetite statement is on pages 5 through 7 at the start of today's papers. This is here to support the board in its decision-making process. Turn down to declarations of interest and privacy statements. Are there any? Thank you, Amanda, first.
Yeah, I have one for the exempt 19.1. I use the services, so I've decided that so to declare the declaration. Sorry.
Just for clarity, can I ask you to confirm if it's a transparency statement if you intend to remain for the item?
No.
Or if it's a declaration?
There's a declaration of interest.
Well, I can assist you when the time comes. And Lynn.
Just a transparency statement from me. I'm recently retired in the whole of NHS Grampian, and I've previously worked for the partnership from 2014 to 2017. And I'm also a retired member of Unison Union Grampian Health Branch. And as I say, just for transparency.
So noted. I'll make my usual transparency statement relating to any aspect of the papers dealing with mental health. And I'm a member of the Diverse Experiences Advisory Panel, a named partner in the Scottish Government's mental health and wellbeing strategy. I'm also the lived experience representative on the Scottish Government's mental health and wellbeing leadership board, and a transparency statement in respect of item 8.1, and that I am a client of the organisation that is subject to the contract discussion, although not in receipt of any statutory services. Having considered the objective test, I believe my conviction is not strong enough to warrant me needing to leave the meeting. I will remain for the item. If there are no other statements, declarations, in which case, thank you very much. We move on to termination of exempt business. We are asked to consider the item at 8.1, which is a supplementary procurement work plan as exempt. The reason we are asked to consider this as exempt is because the item contains information that would render individuals or entities otherwise identifiable, may prejudice ongoing or upcoming contractual or other arrangements. Colleagues will note my presumption against taking papers in their entirety under exempt. However, I'm satisfied on this occasion that this is not only necessary but proportionate. So therefore, my question to you is if we are agreed to take the item as exempt and, as in previous meetings, to rearrange the agenda accordingly to wind up the public part of the meeting before go to exempt. Are we agreed?
Agreed.
We are. Thank you very much. And we're talking about 4.1, which is the formal part of IJB membership on pages 9 through 12. And Emma, is there anything you wanted to add to this?
No, indeed, Chair, quite straightforward. It's just noting the appointment by Aberdeen City Council, Councillor Lynn Thompson as a voting member, Basic Councillor Malik, and to agree to appoint Councillor Thompson to the Clinical and Care Governance Committee.
Recommendations are just that, to note the appointment by Councillor Thompson, the voting member of the Integration Joint Board, and to appoint Councillor Thompson to appoint Lynn to the Clinical and Care Governance Committee. Any questions, or are we having to agree?
Agreed.
And I just wondered, Lynn, to give you the opportunity, if there's anything you wanted to say by way of introduction, you don't have to.
Just a couple of words. Well, that's a relief that everyone agreed to join in. And I hope to sort of reignite my acquaintance with all the things that the IJB gets up to these days, and hopefully with my background I can make a contribution to the work of the IJB.
I look forward to it. I understand, I'm always not sure what order to do these things myself, given that there's a formal paper, but it seems impolite not to welcome people at the start, so I share your frustration with that. And thank you. 4.2 is our IJB video. And just for context, these videos are here to showcase the work of the IJB, but perhaps even more importantly, the outcomes that are derived from it. Today's video is on the local outcome improvement plan, the Lloyd. And I'd ask Ian if you want to introduce this.
Thank you, Chair. Good morning, members. The video that you're about to see on the new local outcome improvement plan was co-developed by Aberdeen City Council's communication and marketing team alongside Aberdeen Youth Movement, and sets out the strategic challenges Aberdeen faces, how social determinants of health such as education and access to services and natural environment play major roles in population health. The video introduces 5 system changes within the new 10-year local outcome improvement plan to address our shared challenges, one of which is dedicated to health and social care. The video is also now on display as an exhibition item on the ground floor of Aberdeen Art Gallery, so I'd encourage you to go and take a look. The old members find it informative and enjoyable.
Smart girls.
It should do.
There's the review.
The Local Outcome Improvement Plan, or LOIP for short, aims to make Aberdeen City a place where all people can thrive regardless of background or circumstance. Unfortunately, today in 2026, some people's quality of life is still determined by childhood poverty, the neighbourhood they live in, and their ability to access support. Over the next 10 years, the Local Outcome Improvement Plan will deliver 5 changes to make sure that people and communities who need additional resources and support get the help they need to thrive. At the same time, everyone will continue to have access to regular services like education, healthcare and policing that are already provided in the city, making Aberdeen a healthier and fairer place for all of us to live in. So, what changes can you expect to see? What will Aberdeen be like in 2036?
Young people from wealthier parts of the city are more likely to finish school and go to university or into training or work. Too many children from poorer areas, through no fault of their own, can't access the opportunities and experiences they need to build successful lives. Young people who have experienced trauma in early life are at greater risk of disengaging from school and require extra support to prevent lifelong disadvantage.
When I'm listened to, things feel different. It makes me feel like I matter. I know what helps me feel safe and what doesn't. Sometimes I don't always feel safe, and that's hard. But if I could be involved in designing safe spaces, they'd feel different, more comfortable, more supported, like I belong.
The local outcome improvement plan will involve more young people in designing unsafe spaces and informing and receiving the personalized support that they need to prevent harm. More vulnerable young people will be in work, training, or education after school.
1 in 7 households has nobody in employment, and too many children live in low-income households. Employment rates for ethnic minority residents are below the city average. Young people and those without qualifications face barriers to work, as do single parents. At the same time, 10% of employees earn less than the living wage, meaning work does not always protect people from poverty.
I faced significant challenges securing employment in my field. As time passed, I felt increasingly overlooked. My confidence began to decline. At times, struggled with feelings of self-doubt and worthlessness.
People have so much untapped potential. Their life skills and experience should be valued. The local outcome improvement plan will provide more skills development opportunities in high-demand employment areas. It will become easier for people to find jobs which offer fairer working conditions. This means that in Aberdeen, by 2036, working lives and wages in the city will be fairer, and employment gaps between disadvantaged groups and the city average will be narrowed.
Today in Aberdeen, many people are facing significant challenges with growing pressures around the cost of living. Rising costs, insecure incomes and inefficient housing have left 18% of the population in relative poverty, with thousands of children growing up in low-income households. Lone parents, larger families, those with very young children, younger mothers, families affected by disability, and minority ethnic communities face the greatest vulnerability to child poverty. Support systems, though well-intentioned, are not always joined up and are reactive, leaving gaps that perpetuate hardship and increase the risk of homelessness.
Getting the support in the city can feel quite a tedious process, having to contact multiple people, and it can be really time-consuming. Services are needed in one place.
The local outcome improvement plan will make sure more people receive the right support in the right place and at the right time.
Hi, welcome to the Hub. It's nice to see you. How can I help you today?
Reducing the risk of poverty and homelessness. People will be able to access all of the help they need, from financial, housing and food to health and employability and family support at the same time. Vulnerable families will receive support from the same person, and preventable harms such as mental well-being, domestic violence and substance use will reduce. More people living in Aberdeen City will have been lifted out of poverty, and fewer people will be at risk of homelessness.
Too many communities in Aberdeen, particularly people with the highest levels of need living in our most deprived areas, continue to feel that they don't have influence in things that matter in their neighborhood. Access to green spaces and nature-based activities improves mental well-being, reduces social isolation, and strengthens community cohesion. However, access is unequal across the city, and people in the most deprived neighborhoods experience more barriers to making use of it. Climate and energy challenges intensify these inequalities.
Mount Holyfood Forest is a green space for the community to visit, interact with, and enjoy. Started by a group of residents coming together to create an oasis of peace, the group has made the decisions on how the forest will develop over the coming years.
Focusing on deprived neighborhoods, the local outcome improvement plan will make it easier for people to have a say about their neighborhood, shaping their environment. People will be more connected, have greater influence over their communities, and live in a healthier, greener, and more sustainable city. Healthy life expectancy is declining, and people in deprived communities not only live shorter lives, but spend more years in poor health. Too many people in Aberdeen are experiencing harms, and preventable deaths relating to substance use, gambling, and mental health are rising. People feel unable to ask for help and fear judgment and stigmatization. It is also difficult to understand how to access the right support at the right time.
I'm a person in recovery. I'm also a mother, a wife and a grandmother. Going in and having to tell your story to this service and then go back into another service and tell your story again. And it's just raking up stuff for you constantly, so you're re-traumatised all the time. Having that one-stop shop where people talk to each other would make things so much easier for people going forward.
The local outcome improvement plan will provide new recovery options to help reduce stigma and isolation for people with complex needs over time, providing the support that meets their individual needs, and this being coordinated for them will avoid people having to repeat their stories and help people stay engaged. People's lives in Aberdeen City will be healthier and happier for longer. The gap in preventable deaths between neighbourhoods has been reduced.
We think a decent quality of life should be the reality and not a dream, achievable for everyone in Aberdeen by 2036. Aberdeen's local outcome improvement plan is working to make this happen.
Thank you very much, and thank you to all the people, especially the young people who have taken in the production of that. I think it was a long video, but I think it explained really aptly and some great examples as to how the Lloyd pretends to prove something of those we support in the next 10 years. Are there any questions, comments, people? Okay. Okay, thanks very much, and thanks Ian for introducing that. Appreciate it. Moving now to item 4.3, which is the minutes of the IJB meeting that we held on the 12th of May earlier this year. I'm going to start by asking if there are any questions or comments on the minutes. In which case, I propose to put only a single question on the minutes for approval. Does any member object? No member objects. That is, I will therefore happy to agree.
Yeah.
Thank you very much. 4.4 is the business planner on pages 23 to 24. And I ask Fiona to introduce this and raise any points as you wish.
Yeah, thank you, Sam. So on the agenda for today, we did have a financial position update asked for. We have discussed it with Jonathan, and actually, and in Q1 doesn't end until today. We've asked that we defer that to September. We'll give an update to the IGB in September of our Q1 position. As we will continue to have that oversight, third budgeting oversight group, and if there's any early indications that we need to let people know, wait until January, September to do that. So okay, we'll just defer. I'll take that off the agenda first.
Any questions for you? John?
Yeah, just to say that we actually, because the financial sustainability is always a big issue on our risk register, we had quite a long discussion about this at the Risk and Audit Committee last week, before last, recently. I think the fact that budget savings oversight group is meeting fortnightly and will alert either Skin Audit or the RGB as a whole if there's anything that's looking good, slightly off kilter. I think that's very reassuring.
Thank you, Hussein. What do we mean by off kilter? Where's our limitations in that? Sorry, I have no disrespect to you, Vice Chair, but just where do we see that it might trigger something rather than just having an arbitrary figure? That's anything you can put on that?
That's a good question for me, but I'll pass it off.
Yeah.
Saying, just as an reply to that, I think that is our job to reply to. However, what I would suggest is that clearly we've got a number of parameters. We know the savings that we're looking to achieve. We've got the plan in place, and I think there are points of escalation which start the escalation to me, to Fiona, just in terms of where we're at, but clearly that first opportunity of bringing together a report in front of either the committee or the IJB is the next cycle. I don't know that I'd be working to a number at this moment in time. I think anything from a materiality point of view starts to stretch into millions, but we know from the risk registers that actually major is something that we're always conscious of in terms of the value of potential variance or deviation that we've got, and I suppose bringing that together and making sure that you're notifying of a comprehensive variance analysis across that first quarter reporting will hopefully ensure that we get to the right place and strike the right balance in terms of managing those variances.
I'm happy with that. I think, reporting clear on is fine, but it's just making some definitions that we don't end up varying too far out before we get an alert on it as such. That's the only thing I would say. Thank you.
I'm sure John's very relieved, John, to meet you here. Can I just ask the question, if I may, just about the annual performance report, just for clarity? Where do we see that landing in the life cycle of the IGBT?
So it's on the business planner for the 30th of September.
I'm asking. Use that bit of data, but thanks for the clarification. If there are no further questions, are we happy to agree? Yes, we are. Thank you very much. 4.5 is the IGB Insights Planner on page 25. Alison, did you want to add anything?
Yes, if I can. I can't believe we're at the point of organising another one, but our next one is the 14th of July. On the planner there, it says hosted services and hospital at home. I'm going to propose that we maybe delay the hosted services item. There is a paper on hosted services later on your agenda. And there is a proposal in that we will bring back baseline performance data on hosted services to the 1st of December meeting. So I'm going to suggest we perhaps defer the discussion on hosted services to the November Insights meeting. Other than that, we are having a discussion at the Risk Audit and Performance Committee Development session next Wednesday on the topics on the Insights Planner, just to see whether any of these should be converted to a report going to the Risk Audit and Performance Committee that was discussed at the committee last week. So there may, just to advise the IJB, that there may be some changes to the planner moving forward. We'll keep it up to date so they can see it at each of your meetings.
Thank you very much. Any questions or comments?
Yeah, does that mean that the 14th of July meeting's postponed?
No, sorry, the 14th of July meeting will go ahead. We will have a couple of agenda items for that.
Thanks, Alison. Sorry, but I just wanted to be sure.
Sorry for the confusion.
Subject to the changes that Alison has proposed, are we happy to agree to these?
Yeah.
Yeah, we are, thank you. Down now to item 4.6, Chief Officer's Report, pages 27 through 34. And I'll pass over to you.
Thank you, Chair. Steve, sorry, I'm going to find it. They're happy, and there's just the oversight of what's happening locally, nationally, and regionally, what we're doing. I think I do want to flag the Pathway to Excellence. It's a fantastic to achieve that designation for a mental health and disability specialist service and wider is great recognition of what the team have done and worked collectively together to improve what they are doing in service for their staff as well as their patients, and is to get that designation, the first in Scotland and actually the first in the UK to receive that. I just think it's definitely worth highlighting today. Thank you.
I have a couple of questions, but before I do, does someone else want to come in?
Yeah, what part of my notes was to congratulate on the Pathway of Excellence. I think it's a fantastic achievement. I think that the team should be congratulated throughout. I think it was highlighted at NHS Grampians board meeting as well. So that was my only comment on the report. So thank you very much.
Yeah, my only comment was on the discharge to assess update. Just pleased to see the number of bed days saved, which is good, encouraging.
And I just wanted to ask a couple of questions. Firstly, around the KPMG update. I was just wondering if you could outline, as that 12-week outline timeframe for that. It's a once for Grampian approach, so see that the 3 IGBs working in partnership. What's the route to governance for that in terms of once that has been delivered? How does that then go through whatever processes it needs to go through?
Yeah, happy to respond to that. Same, so as you say, it is a 12-week commission that KPMG have got. It's due to conclude about mid-August is the 12-week period. They will then, first of all, because although it's the 3 IGBs that's involved, it's also the local authorities and NHS Grampian, so it's collective right across the region, as you said. So what will happen is they will present to the executive team in NHS Grampian initially the findings, and obviously the 3 chief officers sit on that, and then we will take that through our own governance routes. We will have something that we set back to the IGB. What that will look like at the moment, I don't know. But once we've got that report from them, what that will finally look like, we'll make sure it comes through the IGBs, and that will be replicated across the region with the Central Stamping Board and the IGBs that are partnerships and the council as needed.
Thank you. That's great to hear. My other question was around the GP walk-in centre, which I alluded to earlier. It's great to see that happening. First, just have a question of practicalities, just to understand, because I think a lot of people may have a similar question. It's also based in the health village. Is there a catchment area for people who can use that, or is walk-in imply literally anyone can walk in?
So it's a different model across the country, but for Aberdeen, it is anyone can walk in. So absolutely, in some other parts of the walk-in centre, we're restricted to GP practices, but not a model that we've done for Aberdeen City. So any people from out with Aberdeen can walk in. It really is available for anybody, whether you're an overseas visitor or whether you're somebody local to the area, Aberdeenshire, anybody is welcome.
Thank you for that. And I suppose a similar question to around the KPMG. Obviously, hope this will be a success. It seems to have been well received in other parts of the country. It's a Scottish Government initiative, but it's delivered by ourselves here. How does the reporting help for that, and what are the rough timescales?
For KPMG?
For the walking centre.
For the walking centre. I'm too scared to ask Emma because, so Emma, I will try and do it because I'm conscious Emma's online, and I will smile and hope Emma smiles with me. So there will be reporting. We have to go back nationally, obviously, for the walk-in centres. I'm not sure how frequent. I know Emma's having weekly meetings with Scottish Government colleagues, so they're very close monitoring of it. And obviously Emma's leading for Grampian, so she's supporting Aberdeenshire and money to get theirs up and running. So the weekly meetings continue, and I'm not sure exactly when the reporting will happen. I imagine it's quarterly, but I'm going to try and do this and hopefully not deafen you all. I will stop speaking and let you come in then.
So can you hear me?
Yeah.
Yeah, so the initial evaluation, we're going to do a 6-week period, and then it will be quarterly. We're working with the local list team and Health Improvement Scotland to ensure that our valuation has a baseline that's consistent across all our walk-ins in Scotland, with just a local view as well. Sorry, I'm getting reverb on this. It's really weird.
It's because the computer's on, the television's on as well.
It's gone really well. I don't know if you just want a general update. So we've seen a total of 50.
See if we can stop.
It's equity, but it's all of it.
Shall I try again? Is that better? Yeah. So just a general update, 56 people seen last week. We weren't open at the weekend due to the bank shifts. So our salary contracts start in August because there was a 3-month notice period. So at the moment, the rota is at the hands of bank, which means it can change at last minute. However, this week we have a service running every day. Albeit it's not from 12 to 8 every day, but we do have a service every day this week. And out of all the people we saw, only 5 were signposted to other services because some of them were around GP paperwork and blood samples, and 1 was a dog bite that went to A&E. But we have seen a spectrum of babies to older people, pregnant people. We've seen a whole spectrum of people that have all met the criteria and been appropriate. So far, it's been 100% positive feedback.
Thank you for persevering through that technical glitch there. And I'm sure I speak for everyone here when I say please pass our thanks down to the staff delivering that. It sounds like a really great start, and fingers crossed that continues. I have Marks.
Sorry, if I just come back on that one, and hopefully you can hear me. Do you have any correlation to whether or not some of those patients would have attended ED departments?
So no, only the one the dog bite that should have gone to A&E initially. So for ED and A&E, we meet low level of acuity in the walk-in. So if you're appropriate for the walk-in, it shouldn't be supporting ED or A&E because those presentations wouldn't present there. How it will support ED and A&E are those presentations that go to ED or ED and are inappropriate, low level of acuity.
Yeah, that was the point I was asking. Do we correlate, or do we know those that may have gone to ED previously that are now going to GP walk-ins, which would be an advantage, I would see, from an ED point of view.
Yes, that's part of the evaluation, but to date we haven't had anyone.
Thank you.
Thanks, Lucy. It's not on the, it's just kind of on the delayed discharge. I agree with John, about that it's improving, and I hope that continues, because I actually sort of know of a few people that have been caught with that, having to go to hospital and sort of having to wait because, ambulances are sort of backed up and that. So I just want to congratulate you on that.
Absolutely, the comments. Any more for you now? Recommendations are on page 27. We're asked to in the report. Are we happy to go next?
Yeah.
We are, and thanks for your report. We now move to test on technology. We move on to 5.1, which is the review of the scheme of governance. And before I invite Jess to introduce this, can I just firstly start by thanking her for a huge amount of work in a very constrained space of time. And also to thank John, Fiona, and the chairs of our committees for the input that they've given into this. It is important that this is reviewed, and it is very much appreciated. This report takes us from pages 39 through 98, and I remind you that there are 4 appendices. For those using the accessible versions of the documents, the appendices are included within those as well. And fingers crossed, can I invite Jess to speak to this as you wish?
Good morning. Can everybody hear me okay in the room? Yay! I'm glad Emma went first. Good morning. So this is the IGB's annual scheme of governance, and the 2 main documents that have been amended and are up for approval are the standing orders, which have been changed to reflect the legislative change coming in on the 1st of September in respect of lived experience representatives, and the terms of reference, the combined terms of reference. Oh. That's a bit of a feedback. Shall I continue? Yep, okay. And the combined terms of reference, which have been revised to provide more clarity and scope around the IGB itself and its committees. Happy to answer any questions anybody might have.
Thank you, Jess. Are there any questions?
Yeah, not a question as such, you're saying. Again, just checking you can hear me okay?
Yep.
Yep, perfect. So not a question, just again to appreciate Jess's efforts in checking in with each of the, I guess, committee leads, chairs, vice chairs, and having that conversation. So no, I think it's good practice just to review these arrangements. Some tweaks here and there, I think, but I think that'll strengthen the approach in terms of governance. So just to support the paper. Thanks.
Our Risk and Performance Committee, I'll take that as high praise indeed. Thanks very much, Richie. Anyone else?
Just like to second that, I think the chair's been interactive with me, obviously, the chair.
I would like to third that, shall we say, and I completely agree. Jess put in a power of work. She took the time to listen to everyone's opinions and also explain where she was coming from. And yeah, that was a lot of time, a lot of effort, and I really think, yeah, thank her for the paper.
Before I ask Emma to take us through the recommendations, I propose to move all of these en bloc. Does any member object? No. In which case, Emma, could you take us through those?
It is recommended that the intervention joint board notes that there are no changes to the IGB leaders and service user representatives that sign the roles and responsibilities of the intervention scheme. He considers and approves the revised standing orders for the IGB as attached to Appendix A. He agrees that the standing orders will become effective from the 1st of September 2026. He agrees to combine terms of reference for the IGB, Risk Audit and Performance Committee, Clinical and Care Governance Committee, and Appointments Panel Committee. He instructs the Chief Officer to upload the revised documents as approved at Aberdeen City Health and Social Care Partnerships website.
You happy to agree?
Yeah.
Thank you very much.
Thank you, Chair. Thank you.
6.1 is the Alcohol and Drug Partnership Annual Report 2025 and 2026. So pages 19 through 110. Welcome, Simon. Are you happy to introduce the paper as a wish?
Yes. Morning, everyone. So this is a paper representing work that the Alcohol Drug Partnership has taken on over the past year. There's 2 recommendations. So one, to consider the annual report, in progress, key outcomes, response to emerging risks and drug-related harm. and to come back to the IGB with an updated partnership delivery framework and terms of reference. Excuse me a second. The report highlights work within sort of 5 work streams, so whole family approach, sort of prevention work, reducing harm, morbidity and mortality, supporting service quality improvement, supporting recovery, and developing intelligence-led delivery to our programme of work, so looking at outcomes and local governments. There's quite a lot of data there that we've tried to capture, but we've also put in the voices of people who've used our services and service user feedback to try and give a sense of the quality of what people are experiencing when they're looking for help. The Scottish Government republished its national strategy in March, along with a service specification, a national service specification, and a new partnership delivery framework. And the partnership delivery framework sets out new arrangements that should exist between ADPs, IGBs, and chief officer groups and community planning partnerships. So that really tightens up on governance and accountability and local reporting that needs to be put in place. And happy to take any questions. There's any points that we'd like to put in or discuss.
Thanks, Simon. Are there any questions or comments?
Thanks, Lucy. Yeah, I was just, I think it's an excellent report, and I was just going to sort of mention that you know, on the comments, there was an awful lot of really positive ones, but I think the ones that really stood out for me were the fact that there was, you know, people are not judgmental, because I mean, I know from personal experience and from things other people have told me that if you, the minute you judge somebody, then they just don't go back. So I think well done on that.
Thanks so much, and thank you for the report. It's very detailed. Just going to the advocacy, the 18 work we say, Service Aberdeen, and just the barriers that you noted in that regard to obviously stigma, but digital exclusion. What are we doing regarding these barriers?
So these could be taken forward. So part of what we have to develop a rights-based approach. So we would use the underpinning charter of rights or substance use to help sort of give a platform to how we take those particular actions forward, but we would take them into our work plan for the coming year. In terms of digital exclusion, we had tried to put in a bid for some funding, which wasn't successful around sort of digital inclusion funding that the Scottish Government had. We still, I mean, helping people with substance use is still very much a sort of person-to-person relationship, attachment-based sort of therapeutic approach that we take. But I guess the disadvantage that we see is increasingly as our systems become more digitised, that people find it difficult to navigate those systems. So Advocacy Aberdeen are supporting us in terms of helping people navigate that system and trying to engage service users about how we make that process. And so we're looking at digital sort of access points, and some of the points in the Lloyd particular system change 3, where we're having more accessible hubs that deal with housing, poverty, welfare, sort of food access and things like that. I think will give big contribution to making it much easier for all to navigate our system by being able to go to a single point and have all those services sort of joined up and support it rapidly.
Yeah, that's very clear. Thank you.
Thank you.
Was it myself who said sorry, just missed that?
Yeah, go ahead.
Yeah, perfect, thanks. Yeah, and thanks for the paper again as well. It's an incredibly challenging area of work, this, and I guess partnership working collaboration is really, really important in terms of being able to address the issues effectively. So it's just, I guess, a general question around how well you feel that, I'll include the IGB in this, but more broadly, how well you feel that partnership working is going. Is it effective? And I guess underneath that, is there anything you think we could do better in terms of partnership activity, or are we doing all that we reasonably can? Thanks.
Obviously very biased in terms of my opinion in that, and I don't have, well, whilst it's a challenging job, I don't have the balance or the task of balancing all the other priorities that are in the system. I do think that alcohol and drug harm is extremely damaging to individuals, families and communities, and really a devastating impact in some of our more deprived communities in particular. So I think there's always more that we can do. I think there are infrastructure things that we can improve on in terms of governance and oversight. It is still very much an emergent problem in our population. It's still something that has significant amounts of stigma and blame and violence and all sorts of difficulties related to it. So I think the day that we can say we no longer need an ADP because it is so much embedded into the bricks and mortar of everything that we do will be the day that I say there's not anything more that we can't be doing. It's part and parcel of our daily work. So I think the LIPE in particular, the support that colleagues have given around that, making sure that alcohol and drugs is really central to that work is really important. The fact that I'm here updating you and that people are interested, that the insight session that we had, there was good discussion and questions, all of these things are great. But everybody has a role to ensure that we consistently give the message that people who need help can get help, and that there are prevention activities that we can all take part in.
Thank you.
Yes, really just want to echo and support Amanda's very good point about no judgmental stuff, and that people don't wake up one morning and say, right, I'm going to be a substance abuser. So there's always a reason behind it. So the fact that someone has got a problem, when they're accessing services, it's important that they're not judged, and they know before they access those services that they're not going to be judged. And actually that kind of applies to all sorts of mental health issues as well. So I could have made that comment on the boy. Yeah, no, I think that's really important. No stigma, no judgmental stuff, and all these things. I think it's good to totally it's a mantra we need to be pushing.
I have just one question, if I may, and obviously, in some ways, it picks up on the point that Mark was making around digital, because with the proliferation of AI, and I'm using it myself to ask you a question regarding a particular medication or healthcare in general, and you have to be so careful as to which sources of information you trust, and particularly amongst younger people who are far more clued into social networking and all the various apps that are available. It has been recognized that there is a huge risk around potential misinformation and disinformation. I'm just wondering anecdotally, is that something that you are finding is an issue? If it is an issue, are you able to move it? And do you have the capacity to be able to fight against that? And what can we do in that area if anything is needed to be done in that area?
I don't think I've come across people using misinformation in some senses, but I guess the worry and the concern is that a lot of young people and a lot of the illicit black market supply of substances, illicit substances, does happen online through social media, and that's something that's obviously very, very difficult to be sort of disrupt. Talking about national, international, organised crime, etc. So that aspect of it is very concerning, but I think it's probably out with our scope to realistically disrupt it. I guess our public health colleague consultant has made the point that one of the ways that we want to try and engage younger people in particular around safety messages around substance use is through TikTok and social media, Snapchat, etc. but the government are also in the process of making these unavailable for young people. So there will have to be some consideration around how we potentially educate and support young people to be resilient in whatever the future is around AI, technology, and harmful content. I think that's probably a challenge for as well as us.
Absolutely. I'm sure you probably have this covered already, but I know I'm signed up to Neighbourhood Watch. They send an email around usually it's once a week, and a lot of different public service agencies will often hook into that to spread a messaging, whether it's to do with crime alerts or be on the lookout for scams, weather alerts, and other warnings. So that might be a potential route if it's not already being used, particularly because parents, carers, guardians of young people may also be hooked into that for their kind of general awareness as well. So it may be a channel that's worth exploring.
That's a good idea.
Any other comments, questions for Sam? Okay. We have recommendations are dated 99 to 100. We are asked that the Integration Joint Board considers the annual report for 2025-26 for progress, key outcomes, and response to emerging risks of drug-related harms, and also to instruct the Chief Officer to report back on the updated ADP strategic delivery framework and partnership delivery framework and associated ADP terms of reference. We have to agree.
Yeah.
Agreed.
I have to say, Robert Lewis seems to be an expert in tongue twisters. Really making it work. Thank you very much, and thanks for all your work to your team as well. Just give me. And we'll make start and also pop back in just a moment. And item 6.2 is the hosted services service level agreements. Hosted services service level agreements on these pages 211 to 230. For guidance, there are 15 and 40 dependencies attached to this. I won't go through all of them, but just by way of guidance, the initial internal audit report is available on pages 119 to 134. Progress on the recommendations and commentaries on pages 135 to 136. And the following appendices are relating to the individual services. For anyone using the accessible version, these were provided as separate documents. And that being said, I invite Alison to speak to this one as wish.
Thanks, Sam. The IGB will be aware that they, along with IGBs in Murray and Aberdeenshire, have responsibility for strategic planning for hosted services in the Grampian area. This report proposes the implementation of new governance arrangements for these services in the form of service level agreements, or SLAs, which detail the services delivered and the performance measures used to demonstrate performance. This includes financial performance. The detail within this report was approved by Murray's IGB on the 25th of June, and it's due to be considered by Aberdeenshire IGB tomorrow, the 1st of July. It's anticipated that there will be performance reporting against these SLAs. However, the format and frequency of this has yet to be determined. There is a proposal that we bring back baseline performance data for each service relating to financial year 25-26 to the three IGBs between November 26 and January 27, just depending on the various IGB timescales, in order that informed decisions on format and frequency of reporting can be made. The implementation of these arrangements is the culmination of a number of years of work in this area, not least the recommendations made in an internal audit report in March 2024, which deemed the risk rating to be moderate and the assurance assessment to be reasonable. Hosted services vary in terms of size of budget, complexity of service delivery and level of clinical risk. The internal audit report confirmed that governance arrangements should be proportionate, so the SLAs vary in the level of detail that is incorporated. It's anticipated that the format and frequency of the performance reporting arrangements will also take niceness of budget, complexity and risk. The arrangements are designed to improve transparency and accountability in order that all three IGBs can discharge their responsibility in relation to strategic planning for hosted services effectively. I draw your attention to paragraph 4.6 of the report, where road developments in relation to the inpatient frailty service and sub-LAs for primary care services for prison healthcare are in progress but not yet fully in place. Hosted services are no different to other delegated services in that there's a constant need to review these to ensure sustainability in a challenging environment in which we operate. I'd also refer you to paragraph 4.8 where the approach for agreeing future transformation activity is detailed. The IGB is asked to approve the implementation of the service level agreement approach for hosted services, including the approach to agreeing transformation activity. The IGB is also asked to instruct the Chief Officer to submit baseline data reports to the IGB meeting of 1st of December 2026 to inform a decision on performance reporting arrangements going forward. My colleagues from Murray, Jeanette Netherwood and Aberdeenshire, Shona Campbell, who along with myself were responsible for coordinating the compilation of the LOAs and the information contained within this report, have joined our meeting today.
Alison, welcome, Jeanette and Shona. It's great to have you. Are there any questions or comments? Any of our speakers?
Thank you, so I've got a couple of questions. First of all, 4.8, word transformation. We think that having to get agreement from 3 IGBs is going to slow up any transformation.
I hope not. But when we're looking at transformation, the operational teams will be working very closely together, and we're hoping that dialogue will feed up into the IGBs, and that there will be a general consensus on approach to transformation really before it gets to the IGB level. So we're hoping that continued sort of joint working will assist that smooth process.
And do you have any mechanisms that we can use in our terms of reference to influence those if we're not making progress?
So the performance reporting on the SLAs will be the opportunity for the IGBs to determine whether that progress is being made and influence what happens going forward.
Yeah, I suppose it's just with regards to the governance around that. How is that going to, play out if we don't get agreement? Have we got ways forward? And I know it's a bit pedantic and operational, but we need to be thinking about if we're not getting, if we're looking for transformation to occur, how does that happen if we can't get agreement? So you might have the answer to that. Maybe we'll come back to me because it's quite complex in discussion. But just one sort of thing that came out for me. The other thing that came out for me was, although we're looking at performance of SLAs, then the governance arrangements, I'm assuming, will not change within those things, and they will all still report to the governance.
Yes.
Okay, that's fine. Thank you. Thank you, Jim.
Okay, John.
I was actually going to ask pretty much the same question. I've been answered. Thank you.
Richie.
Yeah, thanks, Suzanne. And yeah, welcome this report as well, and the transparency around the governance of the hosted services. It's really good to see coming through. Again, quite a bit of work gone into it. I've got maybe two questions. As the internal audit report reflected, there's a variety of, I guess, scale and budget of services that are hosted by the different IGBs. And in terms of having the capacity to satisfy the governance requirements around this, just a question around, and I know maybe a bit biased being around the city IGB table, but just a question around, is there capacity? Is that being able to be absorbed in terms of impact on our team and our kind of focus in the city IGB? And I guess it'd be a similar question for Aberdeenshire and Murray colleagues just around that. Yeah, but it's good that we've got the governance clearer around the hosted services. It's just the impact on, I guess, our core and other services within the IGB, and that's able to be absorbed. Thanks.
So I think the development of the SLAs themselves took quite a bit of time and effort, but now that they are in place, and pending the agreement on how we are going to report against these, I think we'll be taking cognizance of the capacity available when we make proposals around about how often we're going to report. We are thinking that for the bigger services, there probably will be an annual report, but we've deliberately tried to identify performance measures that the services use already. So we're not really asking them to do anything over and above. It's just pulling that into a report for the SLA. So we will try, there is limited capacity, but we will try to make sure that whatever proposals we make, particularly in relation to performance reporting, allows that to happen within the capacity that we have.
Yeah, thanks. And just through yourself for saying that, that's helpful, Alison. Thanks. I guess it's just trying to get that right balance point just around being effective governance and capacity. So that's helpful. It's on the radar. Thanks.
Thanks, Richie. I have one question, Alison. Perhaps it may just be that you have just rephrased this in a slightly different way just to help my understanding. But in my experience in other areas with SLAs is, it's an agreement or a contract for, without needing to use the kind of legal definition of it, as to what we're going to do and how we're going to do it and who's going to provide it. And it's for saturation. But I noted in the paper it said these are rolling agreements, but then we've also got these performance monitoring milestones, so to speak, once we've agreed. And I also know the points that you make about a minor and major transformation, which in reality is going to be for eternity. These services are always going to be evolving. But I guess my question is there ever a point where these SLAs are formally reviewed, or is that going to be incorporated into the performance monitoring, or what's the kind of period, or how does that all reconcile?
Yeah, absolutely. It would be incorporated into the performance reporting. So when we bring a performance report, if there is anything that's changing or anything that we think is currently in the SLA that needs to change, we will bring that to you at that point. We didn't want to put a timescale on the SLA because, as I say, it was quite a lengthy process to compile them all. So we didn't want to have to do that again and again on a regular basis. So that's why we opted for the rolling one. And although we were calling it an SLA, it is very light touch in terms of it. It's not a contract by any manner of means. It's just really a description of the services and how we're going to measure performance against them. So hopefully that answers you.
It does indeed. Thank you very much. Any other questions or comments? Okay, in that case, we have recommendations which are on page 112. And that is the Bridge Board approves the implementation of service level agreements contained within appendices C to N, noting the developments highlighted in paragraph 46. That we improve the approach to agreeing transformational activity details in paragraph 4.8. Instruct the Chief Officer to submit baseline data points to the IGBBT on the 1st of December 2026 to inform a decision on performance reporting arrangements going forward. Are we happy to agree?
Yeah.
We are, thank you very much. It's 11:14. I was going to call a break at some point. Do colleagues want to deal with the Lloyd now, or do colleagues want to break it? I get steered for. Okay, we'll take a 10-minute break.
You're going to be a tailor. Give you 20 quid.